There's meeting to order. Mikey, if you could call the roll.
Mr. Barnes.
Present.
Mr. Edwards.
Here.
Mr. Martin is not here. Commissioner Smith.
He's here.
Dr. Solano. Here. Mr. Stavros.
Here.
Dr. Marshall.
Here.
Madam Chair, you have quorum.
Great. Thank you. Good afternoon, everyone. We have some really interesting and fun, light topics here this afternoon for our committee, too. So we will, first I need a motion to approve the minutes from our last meeting. Discussion? Any discussion? All in favor?
Aye.
Opposed? Motion carries. Thank you. I want to kind of go through our first agenda item, which is the excessive alcohol use on campus. This has been a really important issue for the Student Affairs Committee, and one of the things that, just to kind of brief recap of how we got here, the VPs for Student Affairs met, the student body presidents met, and this was one of the top issues, particularly with the VP of Student Affairs from all of our campuses, that we addressed as kind of a critical need. And we've been continuing to try to make the focus of student affairs be things that are actionable and meaningful and can make a difference, and not just bring things that we need to make you aware of. And in doing so, this issue still has kind of continued to progress and evolve. And we've had a number of different presentations from a number of different experts, and I think that the one of the general consensus is that it is an issue, and that it is a little bit different on each campus, and the dynamic between the local governments and each campus is different, and that one size does not necessarily fit all as we address this very important issue. And so we really have worked to try to build some consensus, because we also want to succeed and we want to come up with something that can get passed in the legislature and that can make a difference. In doing so, and with the chancellor, in the midst of all of that, we've kind of had a change in our chancellor, and we've had a change in some of our student affairs, well, within the chair of the student affairs group, and we've really been working on coalitions. We've had discussions with the Florida League of Cities. The chancellor has had discussions with the Restaurant Association and Liquor Lobby, I guess, via that discussion. We've reached out to the Florida Association of Counties. Our staff has also been working with the Department of Professional and Business Regulation. This is a complex issue, and there's not a quick, simple, easy solution to it. But one of the things, and when we wanted you to see the language that we're looking at, we think it is very important, and I'm going to have Dr. Ihas come up and give us an overview of the language, but we want to make sure we've got your consensus on it. But what we really want as our action going forward on this is not necessarily a passage of this particular set of language, but your general feedback and your consensus that we are on the right path, because we want to have a meeting with all of these parties. The chancellor has done an amazing job getting some of these people to the table, and maybe it might be good if you could just kind of share a little bit about where we are at that before we get into the overview of the language.
Thank you, Madam Chair. Very quickly, I will just tell you, and Chair said it very well, this is a very complicated issue. It does not appear that way on the surface, and yet, like so many major problems that we face in the universities, and this one just in our communities, it's multifaceted and requires multi-solution. We have reached out to many of the constituencies, including local governments, including some of the associations involved. And the good news is the issue has now been elevated, I think, significantly for everyone, local governments and associations involved. The universities already knew it was a significant issue, not just for university students. As we all know, binge drinking and underage drinking is a problem of youth. It is not just a problem of universities. And so the good news, again, is it has been significantly elevated. People have started to proffer different ideas, possibilities, and opportunities that have yet to be nailed down, but I think can provide us with some great inroads on this one. Again, not only to address it at a university level, but to address it as a community. Again, we're a bit premature, perhaps, I guess, is the bottom line with the legislation, to give those things an opportunity to flush completely out as to how we might pursue them over time. So I really am pleased at the work that the chair has done, the committee's done. So many of our vice presidents have been involved in this and others, student government. I think we've got some real opportunities to make some significant inroads on this problem. I think, though, the legislation teed up is probably a bit premature in that regard.
But I would like to have Dr. Ehas give us an overview of where we are, and I really would like the input from the committee that we're on the right direction, we're on the right path, and also just to have a little dialogue as soon as we were done with the presentation on any other ideas and suggestions you guys have as to how we continue to move this ball forward.
Well, thank you all for summarizing so well where we have been and where we have come. And the last meeting, which was in September when we discussed this, we were asked to go and come up with some language, legislative language, that we would bring forward to you for consideration. And in those discussions that Madam Chair Duncan has mentioned, what we have really understood better is the importance of bringing this back to our local communities. This is not a one-size-fits-all issue, but there is nothing in the statutes right now that would permit a community to do anything that would regulate excessive drinking. So in your packets, there is there's a set of information that is entitled Excessive Alcohol Usage on Campus, Proposed Legislation, Community Response to Excessive Alcohol Consumption.
Your agenda. It's stapled behind the Student Affairs agenda.
Okay. And this is different than the title that you received in the mail, and there's a reason for that. And the reason is, rather than pursue a statewide initiative, we are proposing an initiative that would be permissive for communities to review and look at their own situation and then determine how they want to take action. And this is something we've consistently, the message that we've consistently received from all the organizations that we have discussed. As the Chancellor mentioned, there are certainly more conversations to have, and we understand that, and we look forward to those conversations. But since this has been something that we've been bringing forward to the Board for their consideration and their support, it makes those conversations, I think, a little bit easier. And so far, we are getting the attention that we did not have before. So really, what I'm bringing to you really is some language on the agenda, or on the that indicates at least a draft, at least a beginning of how we might permit communities to establish ordinances regulating the provision and sale of unlimited alcohol beverages for a fixed price or for a price less than the actual wholesale cost of the beverage to the retailer. So I think we just need to bring it, the second part of that has to do with not for allowing the same group, a municipality or a community, to enact ordinances regulating the provision or sale of alcohol beverages based on gender. And I think we've showed you examples where promotions are really directed towards different gender groups, to younger individuals, for a very inexpensive cost. And so this is the approach that we have taken and would like for you to review and just to consider, with us.
Thank you. Any questions for Dr. Ehas?
Dr. Ehas, I'd first like to start by thanking you for, we're on now, thanking you for the diligent work that you put forward on this. I know that you've been working on this project for a long time. Even when we were back here in September, we were talking about this issue. So I know that you've been very faithful with it. After speaking with many of my counterparts, I think that we would agree that what you said really hit home, and I'm very encouraged with the language that we have here. It's not a one-size-fits-all type of problem that we face with the different universities, but at the same time, it is something that steps need to be taken towards action needs to come on it. So I just want to thank you for your due diligence on this process, and I'm very encouraged to see this in front of us, and I hope that we'll be able to go back with the community response that you're talking about and really see a positive change from that.
Thank you. It is a piece of the puzzle that we do not have that we need to put into place.
And I was remiss, John, the students have been great, and John has taken a leadership role in getting feedback from all of the students, and they definitely are an important part of being at the table on this, both as to the language we propose and the implementation strategies at each of the campuses. So, I think that it really is taking kind of everybody working together on it. Any other questions for President Hitt?
Madam Chair, I would just like to speak in favor of what is being done, and I think the rather deliberate manner in which we're approaching this is very helpful. I think we need to engage constructively with the hospitality industry, perhaps with the spirits and beverage industry as well, and we do need to acknowledge that this problem manifests itself differently in different locations. So the notion that is being pursued of legislation perhaps that would enable counties and municipalities to respond in ways that are appropriate to their locale, I think is very much appropriate. And I would really like to see us acting in partnership with the hospitality industry to come up with measures that will effectively address what is by any measure a significant and important problem.
Thank you, and thank you for your leadership. You've been, I know in your community you've taken a very active role on this particular issue. Is there feedback from any of the other presidents or board members? So really, I think our next step is, again, don't need a formal vote on approving specific language, but just a general nod of we're on the right direction, we're heading the right path. And then also, so really we're looking at the next step being convening a meeting with the Association of the Restaurants, the Liquor Lobby, the League of Cities, the Florida Association of Counties, obviously students, everybody, all of our constituencies staying engaged with us. If anybody has any other suggestions or feedback that, or groups that you think would be pertinent to have at the table, let us know. Yes.
Question. There are some specific proposed changes to legislation. Do we not need to approve this as a board for it to have more impact as legislators consider this language?
What we really are trying to do, and that at one point we were looking at going forward with that, because we've not been able to have the meeting with the other parties affected by this, we would prefer to not adopt the language until we meet with them and then come back to the board with the specific language in case there is some change or modification that would enhance our ability to succeed with this effort. And so while we've had, and we're very encouraged that they're willing to come to the table and they recognize the importance of this issue, and that's really been a fairly recent, transition here.
Okay.
Yes.
Madam Chair, are you saying then that this is not something that we feel we'll be ready to deal with for this session?
I think timing, we want to move forward with this in a diligent and appropriate manner. If we do, we do. If we don't, we're going to try to get there. We're not trying not to get it done for the session, but we really do think it's important that we sit down with these parties and we have this dialogue before we lock into our position as a board on this.
And what you're saying, Madam Chair, is we're moving away from the original. The committee has done so much. It's evolved, as you said. We've been through a couple chancellors and different chairs, and we've moving away and moving towards now the community response rather than the state legislative response. If I'm correct with.
Well, what I think is needed is the legislative response is needed to empower a potential community response.
Exactly. Okay. Yes.
And in one of our dialogues and one of the discussions and the earlier considerations was, is this something that we would want to just pass the legislation? And again, I think that is where we're hearing and having heard from Tampa, Orlando, a number of different communities. There's so many different approaches. that's why we're kind of moving in this direction. But, there was some good discussion related to potential training things of, restaurant staff or bar staff. I mean, we may not be done. I mean, we may have some better ideas by the time we bring the other partners to the table that will make this even more impactful and stronger.
And exactly what you're saying is rather than kind of rush this through, we're going to take the proper steps to ensure the most success.
Yes, exactly.
Okay.
Absolutely.
And as soon as we have something and we have more consensus, we would definitely bring it back, and it would be appropriate for this board to bless the specific language. Okay. Any other questions on that? Okay, great. Thank you so much. And Dr. Ehas is now the, what do you call it, the chair of the Council of Vice Presidents for Student Affairs?
That's correct.
And
I've taken the baton. So
yes, well,
you'll probably see more of me.
We will see. We look forward to it.
Good.
Everybody's worked very hard on this issue.
Deserves it.
Okay, moving on. We have also had a discussion a number of times in a number of different ways related to student health insurance. It's obviously an important conversation, and we have had a task force that has been working for some time. And so today we'd like to get an update from the task force on from Leslie Sacker, who's the director of FSU Student Health Center and the co-chair of our Student Health Insurance Task Force. And again, I cannot tell you guys how many hours Dr. Ehas and Leslie have been spending on these issues, and just trying to make sure that we've got everybody on the same page, that we have our facts right, and we really are moving the ball forward on these very substantive issues.
Thank you very much, Madam Chair. I appreciate the opportunity to come and speak with you once again about this very critical issue. As you may recall, this is the second convened task force by the Board of Governors. This task force has finished its work by looking at the national picture, the regional picture, and the state of Florida picture in regards to health insurance as it pertains to our college students. Our college students are not 18 to 22. Our college students are very diverse in age, in situations. Some are single, some are married, some are undergrads, some are international, some are veterans. And so we tried to look at every major classification of student to make sure that there were no unintended consequences by our work. We have looked very closely at the developments federally, and as of today, it is still up in the air what kind, if any, legislation might be developed on the federal level. That being said, we do believe that there is only one major avenue for an efficiency of system development within the state of Florida, and that is to look at a intention to negotiate or an RFP to coordinate the 11 universities who currently are purchasing individual health insurance plans at every single university, ranging from benefits of $500 to $250,000. So depending on the luck of the draw where you go, you are not permitted to buy into anybody else's policy. So if you are at a school with very low benefits and you have the unfortunate luck of getting ill or being in an accident, you can run up some very expensive bills very quickly. The committee has looked at the relationship between health, wellness, and student learning. The conclusion that was drawn was that both healthy campuses environmentally and healthy students are able to meet their academic goals. And so we want to make sure that the Board of Governors understands that we believe that there is a very strong relationship in keeping students' risk low, keeping their health status high so that they are not deferring care. We are looking at asking you to, these are only our recommendations, we will come back to you in March with our final proposal. This is simply a draft, and I wanted to give you an update. That the Board of Governors convene a work group consisting of the vice presidents and members of the Florida Health Alliance, who are the directors of the student health centers within the 11 institutions, to see if this RFP could be developed to create an efficiency within the system, allowing for flexibility for those schools that wanted to maintain a voluntary situation. They will not experience the same benefits as in a requirement of attendance, but we are trying to be very respectful of students who may not agree that this is something important to them right now. I can tell you that the Florida State experience has proven to be as successful as we had hoped. We have consistently lowered prices every year. We have deepened our benefits to students, and we have reduced the cost. We have effectively, over 3 years, changed the culture where parents are now reassured that we have provided a safety net 365 days a year for their children anywhere in the world with decent benefits. We have a Blue Cross plan now that is recognized they can go anywhere in the United States or in the world and have that pass. And so for us, we would like to be able to see other schools be allowed to join us so that a purchasing consortium with like schools could also be a potential for somebody like us. We also would like to consider the possibility of opening this up to community colleges, to independent colleges and universities. We don't believe necessarily that the 11 universities of the SUS system could be the only ones to potentially benefit and have their students benefit from this. I think there is a formula to look at and what would be the most cost effective, but I think it's something that the committee, the task force, is very open to. On the back end, the billing end, which is how this newest task force really started for us to look at billing options. The task force is recommending that each individual university make its own determination of what's best for their school based on the billing concept. Many schools are billing, but the smaller schools are reluctant, and we feel that at this juncture in time, that is fine. We would like to make sure that the Board of Governors understands that the state of Florida is surrounded by other states who are paying 100% for their graduate assistants, research assistants, and teaching assistants, who recognize that health insurance is a benefit that graduate students not only want, but are now demanding. And we believe that although there is legislation now to encourage universities to perhaps look at treating them as part-time employees, another unfunded mandate in this economic climate, I think, would be disastrous. And so we are asking that you consider this population, because graduate students to us attract, along with their faculty, the kinds of grants, the kinds of scientific projects, the kinds of monies that will create an economic engine for Florida, and we don't want them to go anywhere else. Currently, there are 2 universities within our system that are paying 100% of graduate student health insurance. One is the University of Florida, and the second is, this year, the University of Central Florida. And the task force really applauded them for doing that. They have approximately an $1,800 policy, where that is a very expensive policy to be paying for anywhere from 2,000 to 4,000 graduate students. So we would like you to consider in your funding request that the legislature understands the importance of retaining graduate students in this regard. And that really highlights the main issues of the health insurance task force. If you've got any questions or concerns, I'm happy to answer them now before we submit our final report to you in March.
First, I want to thank you for your dedication, and also to Mr. John Rogers. I don't know if he's around here anywhere. He actually is. Sorry, John, didn't see you right there. But John has been wonderful in getting everyone together, and this isn't this issue has been well, it's like the national issue, and a lot of people are very passionate about it on both sides. And John did a great job of keeping everyone on the same page and at least moving in the right direction, even if we were going to the right and the left a little bit. The first thing is I think that in our recommendation, I believe in the last conference call we made with the VPs of Student Affairs and also the medical. The people who run the medical facilities at the universities, we're also going to have student representatives. You didn't say that. I don't know.
I'm sorry. Yes, there will be student representatives. Are you talking about on the committee that chooses the policy? Is that what you're talking about? Oh, absolutely. We just haven't gotten to that level of detail. Well, but students will be involved.
Exactly. Okay. Making sure I believe we added that on the last one. The second thing that we spoken about a little bit is you talked about joining Florida State, having other universities join you, and the purchasing consortium that we can have. Currently, unless I'm inaccurate, all universities have the ability to make insurance, to mandate insurance the same way Florida State did, correct?
Well, actually, that hasn't been true until very recently. With the release of the OPAGA report, which was released at Thanksgiving, the path is now clear. Up until that time, no other university was allowed to join us. So that is a new development.
Okay. Well, I think that's a great development, and again, that the students are in support of any university that wants to mandate health insurance for their university to do that. We just are not in support of mandating it across the board. And I know that we're not moving forward with this issue at this time, but I just want to reiterate that I think it's I was talking to the Chancellor about it a little bit, and it's a wonderful idea that you're talking about getting the 11 universities together, and the state colleges and the community colleges, and we've got over a million students in higher education in the state of Florida that we can go in together. But again, where our stance is that for each individual university, we want to allow them to have the option. If UCF wants to go ahead and do mandatory health insurance, the student body presidents don't have a problem with that. The students don't have a problem with that. Our stance is that we just don't want it to be across the board, and I know that was vocalized on our conference call, but I just want to reiterate it with the board here today that is the stance of the students of the state of Florida.
Great. Thank you.
Thank you.
Any other questions or feedback? Yes, Dr. Emmons.
Madam Chair, I want to congratulate the task force and encourage them to continue to address an issue that's extremely important to our students as well as to our universities. But I wanted to clarify the record. There is at least one other institution that pays 100% of the insurance for graduate assistants, and that's Florida A&M University.
Good to know.
I apologize, Mr. President.
Any other questions or feedback? Again, this will be coming to us in March, but yes, Dr. Solano.
Just quick feedback. I think it's also important to the parents of our students. I had one in my office just last week, and I think in the past we always relied on a certain percentage of our students being insured by being covered by their parents' plans. And in today's economy, many of these people have lost their jobs or their company's no longer providing health insurance. And it's become a big concern for them to be able to find affordable health insurance for their students.
I couldn't agree more. And although I think John has articulated very well the student positions who are of those folks who are on the phone, I think that if we had that same conversation with a group of parents around the state, that conversation would be very different. Those parents are very concerned about their children being unprotected, being world travelers, and getting in a car and going home and having no protection. So I think there is a disconnect in terms of understanding the possibilities in this world between being a very healthy 20-year-old and being a parent who is looking out for the welfare of their child.
Right.
Madam Chair, just at the risk of piling on, I just want to thank everyone, too. This is one of those very complicated issues that doesn't look like it when you see it on the surface, but thanks to John and our staff, and of course thank you, Doctor, to you and the members of the task force, and for your leadership, Madam Chair, members of the committee. This was one I think we're making advancements on, and regardless of whether health care is required or not, we not only have an opportunity but perhaps an obligation, and I think we're about to exercise that, to see if we can pull together the power of the whole and throw it up against this issue, and whether it is required or not at the end of the day, provide the lowest cost possibility for students to be able to access health care voluntarily, if that is the case. And to do that and miss the fact that, as John mentioned, we've got just between the state universities and the Florida college system well over 1 million students. Obviously, not all of them would participate, but it's a gigantic pool of potential. And based on the change in the economy, based on the cost of accessible, affordable insurance, it is now a bigger potential pool than it might have been when times were much better. So hopefully we can go to the street with something like that and see a significant return of opportunity, regardless of how we move forward individually as institutions or collectively as a system.
And I think once we submit our final report, Chancellor, you will see that we have investigated states that have done consortiums in a voluntary manner, and those outcomes, those states that have gone mandatory, like North Carolina, South Carolina, and Georgia, that are now requirement of attendance. So we will provide you with real situations about those outcomes, because we want it to be evidence-based.
I really believe if we can find a premium that is the most affordable possible, then volunteerism becomes easier. People wanting to participate because they can provide their students, if they're going to require this, something that is most affordable, marries the voluntary act of requirement, pardon that oxymoron perhaps, but the ability for people to say, we're going to require you to have health care, but we can provide for you a very low cost and affordable health care plan. Those two can marry.
Thank you.
Governor Tripp?
Will you be including in the report how you will take care of those people who are need-based, who do not have the financial wherewithal to do this, so that no student will be left behind? That was my concern way back on this, and I've noticed we've come this full way, and I appreciate all your hard work and your report, but I failed to hear you say anything about what you plan to do in a proposal for those people who will still struggle to try to meet any kind of a demand we might put on them.
Well,
and I think your report... Well, did somebody want to interrupt me? I thought somebody said...
I apologize for not addressing that.
I just think that ought to be addressed in the report.
And it is.
And I haven't heard anything on that, but I can get comfortable with what you're saying on the needs side, but we're increasing tuition costs, we're increasing fees. This will be another cost that some people in this state may not be able to deal with. So, it's great that we want to provide it to the graduate students. I would like us to provide it to every student in this state who can show that they don't have the financial wherewithal to do it. But that's kind of called Medicaid, isn't it?
No, this is covered by the Pell Grant criteria and the Florida Student Assistance Grant.
That's
and
correct.
All of the other
when it's voluntary, it is not. When it is not a cost of attendance, you may not use financial aid to offset the cost of health insurance. However, when it is a requirement of attendance, you may use financial aid. So the very people you're concerned about get a safety net that would otherwise been turned away from every other avenue.
So FSU.
One further question. When you say they can use financial aid, does it give them additional financial aid?
It depends on the school. In some cases we have, but in some cases we have not.
Report, but my question is, if I'm getting 100 now, and now I've got to pay 10 in medical, Okay, does that mean that I've only got 90 left
That's
for the
correct. You
rest,
would have-
or do I get 110 so that...
It depends on the individual
Okay.
school. I would say in most cases, you would be reduced to 90.
Yeah, and that's the problem that I want us to be aware of.
Yes,
That,
I think
I
we've
don't
been-
hear a lot of voices for people out here that don't have the wherewithal.
And Governor Tripp, if I could just interject, because I think you're hitting on one of the central points and issues, though, and that is probably, correct me if I'm wrong, but the plus of the mandated program is those people who qualify for Pell Grants, it's not 90 then, they're getting the 110, okay? If we don't mandate it and we just try to get it cheaper, then yes, it's coming out of their 100.
But Governor Tripp,
That's not what she said. She
No,
said it the other way.
No, they cannot use financial aid to
But
purchase...
they're paying for it. I mean, they're to the point of they're paying for it out of their pocket if we do not mandate the coverage at an institution.
Right.
If it is mandated coverage, then they do get to qualify for and have it not come out of their already allocated allotment of financial aid.
And I think that the move toward being exceptionally concerned about students with financial difficulties has really, I don't know about the other members of the community, but I know it has driven me for the last 5 years to push this issue, because it usually falls on someone's shoulders like me trying to find a provider to treat a patient who has no insurance, who needs an MRI or needs lab work or needs an x-ray or needs a surgery, and there is no provision for that person anywhere in the system. And that person ends up in a terrible, repeatedly terrible situation by being denied care, and then we create another indigent pool on our providers in the community. So it's just a problem that continues to grow on itself.
But if we continue to increase the cost upon those people, you don't have to worry about it. You know why? They won't be in the system because they won't be able to afford to attend a college in this state. And that's my point, and I don't think I'm inconsistent with it. Anybody that's heard me on this board for 3 years and 7 years on the Board of Trustees, and I've heard Gus, somebody has to be speaking out each time we have a new idea that's got a price tag attached to it.
And I concur,
But we
Governor.
also understand that there will be a level of people that will eliminate from the process because they won't have it.
And by the way, that is part of the national dialogue.
Right.
What do you do with millions of people who cannot afford required health care coverage and perhaps can't even afford the fine that they would be required to pay if they had to have it? What are you going to do with people? And it is and needs to continue to be a topic of conversation with all of us. At the end of the day, money is the driving factor with this. If there was money, everybody would be covered with health care insurance in the state university system today. That would be it.
But I hope you're reassured that the task force is looking at efficiencies of the system
Absolutely.
to be able to, whatever we present is based on the fact that it's evidence-based and efficient and effective for the system.
Yes.
And if I just may, I do want to commend the committee. Please don't be confused. While I may disagree, they have nothing but the best intentions. They're trying to look out for those students, Governor Tripp, that you were always talking about. But at the same time, with differential tuition, with CITF not being increased for 20 years and the potential of it, with the parking fees and the housing fees, mandatory health insurance on top of it, at this time is just something that, even though there may be 70% of students who do or do not have their parents' coverage, the fact is that cost on the percentage of students who don't have it, we just don't feel good moving forward with it. Ideally, yes, I think it'd be great if we had health insurance for everyone, and I think it'd be great if we all had our housing costs covered, and I think it'd be great if we could, buy all the students' books for them and save $1,000 a semester. But, it just comes down to where the priorities are, and right now the students just can't afford another tax.
Okay, great. We are way over time already, and if there's any other burning questions, I know we can take them one-on-one, and again, this is just kind of to keep everybody moving forward with this complex issue, we're going to have a lot of dialogue scheduled for this in March. Also, Governor Barnes, I think because we're nearing the end of our agenda, would you mind if we have you give your report tomorrow to the full board and rather than right now in this committee?
That'd be perfect.
Okay.
Thank you.
Okay, great. Any other issues or pressing items? The one thing we did not get to today was starting to talk about our work plan kind of going forward. So if I could ask you all to please give some thought, and if you have any priority issues, get with John Rogers and feed those to him so we can start to develop that plan. We'll be getting a call or meeting with the VPs of Student Affairs and obviously seeking input from the students as well as we pull that together. But with that, meeting adjourned.
Okay, our board members, presidents, and trustee members are invited by President Genshaft to dinner right over here in the Lifsey House. So right now, we're 25 minutes late. Oh, yes, and we will start tomorrow morning at 8:30 with Governor Tripp's audit committee.